Are our guest speakers on?
Hello, and welcome to Sex Talk for Self-Advocates webinar number 5. My name is Anna Costales, and I am the Resource and Dissemination Manager here at ABCD. I would like to thank everyone for joining us today. Before we begin, I'd like to address a few logistical details. We'll provide a brief introduction of our speakers. Following the speaker's presentation, there will be time for questions. Because of the number of participants, your audio lines will be muted throughout the presentation. You can submit questions at any point during the presentation via the chat box on your webinar console. You may send the chat to the whole audience or to the presenters only. We will compile the questions at the end, and we might combine some questions if we don't have enough time. This webinar is being recorded and will be available on AECD's webinar library. There will also be a short 5-question evaluation survey at the close of the webinar. We invite you to provide feedback on the webinar and also to provide suggestions for future topics. I will now pass the mic over to Lindsay Mullis, co-chair of AECD's Sexual Health Special Interest Group. Lindsay?
Thank you so much, Anna. Really grateful for everyone to be on the Sex Talk Self-Advocate Series number 5 today. Our topic is birth control. And so I'd like to introduce our speakers for today. On the next slide, you'll see our first speaker, Randy Lizotte, who works full-time as a peer advocate, facilitating self-advocacy training and support at Northwest Counseling and Support Services, a provider of developmental services in Vermont. During the past 8 years, Randy has worked as a consultant and trainer for Green Mountain self-advocates traveling across the country, providing technical assistance and training to state self-advocacy organizations. Randy was one of the key organizers of the Celebrating Sexuality conference held in Vermont in May of 2007. He's a peer sexuality educator who co-facilitates a men's group and a teacher of a variety of sexuality and self-advocacy workshops. Since 2010, Randy has served as the president of Green Mountain Self-Advocates and was elected by his peers due to his unwavering commitment to speaking the truth. Randy lives with his wife in St. Albans, Vermont. Next, we have Catherine McLaughlin, who's a national expert and trains individual staff and parents on sexuality and developmental disabilities. She teaches sexuality education to people with intellectual and developmental disabilities, as well as to peer sexuality educators themselves. Catherine is the author of an agency school curriculum on sexuality education for people with developmental disabilities, and has developed 2 online courses, one to train professionals and one for parents. On the next slide, we have Erica Thomas. She is also a sexuality self-educator for the Developmental Disabilities Administration Health Initiative, housed at the Georgetown University Center for Child and Human Development, University Center for Excellence in Developmental Disabilities in Washington, D.C. She serves as a liaison between family members, healthcare professionals, as well as individuals that support people with disabilities. Erica develops and implements healthcare information curriculum and education sessions in a variety of wellness topics, including sexuality. For people with disabilities and their support team, she's the faculty team leader and mentor of first-year medical students at Georgetown University, where she prepares future doctors to support and provide excellent healthcare for people with disabilities. Erica actively collaborates with state and local advocacy groups to deliver her message of wellness in the whole person. When she's not advocating for people with disabilities or promoting sexuality education in the community, she enjoys traveling the world, taking long naps, and hanging out with their beautiful brand new baby boy. And on the next slide, we have our wonderful guest speakers that we're excited to have joining us today as well on this topic. First, we have Bonnie Gonzalez, who's a certified peer mentor in Michigan, supports peers to reach their goals. Bonnie was appointed by the governor to serve on the Michigan Developmental Disabilities Council, and she's a sexuality educator trained by Catherine McLaughlin. We also have Jana Weber-Lizotte, who lives with her husband in St. Albans, Vermont. She's taken dance classes all her life and is a leader in the self-advocacy movement. For 12 years, she worked at a child care center, and then a job she loved, and she had to look for a new job when the center downsized. Next week, Jana is starting a new job at a retail store. Lastly, we have Hillary Christian, who lives with her 5-year-old daughter and her parents in rural Vermont. She's an active member and former officer of our self-advocacy group, Capital Advocates Together. Hillary and her partner, Bobby DeFord, have taught workshops and self-advocacy conferences in Maine and Vermont about having relationships and what it's like to care for a baby. During baseball season, Hillary volunteers to support her team, the Vermont Mountaineers. We're excited to have all of our guest speakers today and look forward to hearing from them. In setting the stage for our conversation today, we will be using person-first language, so focusing on the individual. All of the questions that we have are from participants' own words from our survey that we've sent out. We'll also be using medical terminology, so we want to make sure that everybody's familiar with the information on the topic. We also will be making sure that we want everyone to be comfortable because we were discussing relationships and sexuality, which is a very personal topic. If anything that's discussed today does trigger something that makes you uncomfortable or you want to speak with someone, there's the crisis call center there on the screen for you, as well as Julie will add it to the chat line so anyone can be able to make that phone call if they need to. And as Anna mentioned earlier, we do have the chat box available for questions. Please add those as you get them popped in your mind while people are talking today. And then at the end of the webinar, we'll have a few minutes to be able to address any questions that we can answer. You can send them directly to everyone, or if you'd rather have it be private, you can send it specifically to Julie in a private chat, and she will then moderate questions at the end of the webinar. Again, these questions that come forward from birth control came from our national survey. We will have all of our guest speakers type questions through the surveys questions, and then we'll answer any of your questions today at the end. This is the 5th in our series on the Sexual Self-Advocates Talk. The previous 4 videos are all recorded. You can see the links there on the screen, as well as Julie will add those in the chat box as well, and they are also accessible on the AACD website. So without further ado, I'd like to turn it over to Randy to get us started on talking about what is sexual self-advocacy.
Hi. What is sexual self-advocacy? It has all the pieces of self-advocacy like speaking up, being proud of who you are, learning new things, making your case, making decisions, learning from your mistakes. But sexual self-advocacy can be more difficult than regular self-advocacy. For example, telling your boyfriend or girlfriend what movie you want to see is a whole lot easier than telling a person what you want to do when having sex and what you do not want to do. Other examples of sexual self-advocacy are feeling comfortable meeting people, flirting and asking somebody to dance, being free about sexuality, like if you are gay, straight, or lesbian, knowing how to deal with someone pressuring you to do something sexual you don't want to do. Privacy is important. To speak up for it, knowing about birth control and safe sex, dealing with your parents when you don't agree with when they don't agree with you about who you are dating. Erica is going to
We can't hear you.
I was just going to say, are you done with the definition, Randy? Should I start my part? Great,
Yes.
Thank you. And like Randy said, sexual self-advocacy can be more difficult than regular self-advocacy. But even this idea about whether to use birth control, whether to have children, speaking up for what you want or don't want is part of sexual self-advocacy, especially around family planning. Like, do you want to have a family or not? If yes, how many kids? That kind of thing. So we're talking about birth control, but we're going to start off talking about family planning decisions that some self-advocates have made and what led them there, so you can hear some stories from self-advocates. But before, I'm going to do a little introduction, and then we're going to hear from the self-advocate. So just an intro is what is birth control, and so that means controlling birth, right? So if somebody is having vaginal sex and they don't want to have a baby, they can use hormones or barriers, devices, make certain decisions so that they don't make a baby. And Erica's going to talk about all the different ways that people do that. But even though we're talking about birth control, not everyone needs birth control, right? Some people don't have vaginal sex because they don't want to, or they don't have someone to have vaginal sex with, or they're in same-sex relationships, and so they're not having penile vaginal sex. And some people want to have a child too, so you wouldn't use birth control then as well. So what we thought we'd start with is the making family planning decisions, and what is have the self-advocates talk about what is your plan. And I just want to check in and see if Bonnie is on the line. I'm not seeing you. So I'm going to start, if I could jump in with Jana and Hillary, right? I have it right? Jana and Hillary? Who's going to go first? Jana?
I'll go.
Okay, good, because the camera's on you. So, yeah, so if you could tell us, Jana, what have you decided? Do you have children? Have you decided not to or to have that? What's your family plan?
7 years ago, I was living with my parents in Landers. I talked about having a child. Parents and case managers set for me to do a parenting assessment. I knew how to change diapers, so I did not pass. With 50 working years I am married, my parents do not want me to have a child. It was hard for me. For 12 years, I worked at daycare, 5 days a week, 1 plus 2 years old. I go to Planned Parenthood for birth control. Boys, both physical and capable, they are my guardian.
Okay, so what you're saying is that you did an assessment, is that right? Someone helped you with an assessment to sort of figure out whether you had the skills to be a parent or not. And from that, you decided that you didn't want to have a child. Is that what I heard?
Parents.
Your parents decided. Okay. And your guardian. Okay. So you feel like they made the decision for you.
Yeah.
Okay.
Yeah.
And how do you feel about that? Okay, it bothers you a little bit because you want to have a baby. Yeah, yeah. So you're not getting that kind of support right now.
No, I feel like I feel I'm not on my side, like on my side to have one. And if they're not on my side, and if I did have one, the state might take my baby away.
I see. Right, right. And I think what you're bringing up, Jana, is a lot of the stories that we hear about people with disabilities that sometimes they don't have the choice because people don't think that they can do it, or their child's taken away. But there are lots of people who make that choice with disabilities and are able to parent really well, but it seems like sometimes people, excuse me, don't believe that is true.
Yeah.
Could, yeah, sure. Did you always, Jana, want to have a baby when you were little, like as a young girl?
No.
No, it was something.
It's just that because when I used to work in the daycare, I know some people that are working do have kids.
Mm-hmm.
Yeah.
Yeah. So you were in the daycare and you saw that they have kids and you thought, geez, I'd really like to do this myself. But you don't feel like you're getting the support from the people around you.
I've been having a cat doll. I was having a cat doll that I had for a long time, and I got that from my parents to my parents' house.
Yep.
And I've been using that outside the community, and that helps me a little bit.
Yeah. So you have a doll that you can hold and
I have a coffee for it.
uh-huh.
For it.
Yeah. So it's a way to get those needs met of holding a baby and taking care of a baby but not actually having a baby. Great. Good. Thank you so much. I think we'll move on to Hillary. Hi, Hillary.
This is so like sorry, this is Julie. I just wanted to say something really quick. Catherine, when our self-advocates are
Hillary, can you move a little closer to the mic?
so we don't get the feedback while they're answering.
I can't hear you. What?
So I've been with my boyfriend since 2011, and April wasn't planned at all. I was taking the pill at the time, but they're so small to remember, so it wasn't planned at all. And actually on his 25th birthday, that's when I went in and we found out that I was 5 weeks pregnant. And then after she was born, I actually had to go through a cesarean when I had her. And and then I had to do a Mirena because I didn't want to have a kid afterward. And it would be a lot more easier than dealing with a pill every day.
All right, I had to take my audio off, so that took a minute. So it was a surprise, April.
Yeah.
Yeah.
I was actually worried.
Right. And I think when two people decide to have a child, it's this wonderful, happy thing. And when people get sometimes it's a pleasant surprise. You might not have been planning it, but it becomes part of your life and part of your story. And then sometimes people have a lot of really hard times because of an unplanned pregnancy. But it sounds like you have figured out how to raise April and be a mom and use Mirena, and because you don't want to take those little tiny pills.
Yeah.
Yeah. Right. So and having a child, your life is also more hectic, right, and busy, and so remembering to take something every day can be really hard for someone who's a parent. So the Mirena, which Erica will talk about, is the IUD, and you don't have to, you get it implanted or inserted, and then you don't have to worry about it, and it's very effective at preventing pregnancy.
Yeah, it's good for 5 years. So.
Yeah, and before you had your pleasant surprise, April, were you wanting to have a child at some point in your life, or not sure?
Like, I would have liked that I was a little bit older than I was, because I was 21 at the time. And me and my boyfriend Bobby weren't actually thinking about having kids at all. So it was just a big surprise, but I think we were more worried about my family.
Uh-huh.
Because
so telling
he's more protective over me. I'm the baby of the family. So when I told him, because my mom knew I was having the doctor appointment, my dad actually did know, but we were kind of worried what he would do to my boyfriend if he found out. But like an hour after we found out, or he knew, we were surprised at how his reaction was, because on Facebook, yeah, she wrote, "Yay, I'm going to be a grandfather again." So I'm just like, oh, thank God he wasn't going to flip out on my boyfriend. So we were pretty happy after my dad was actually happy about it.
To get your parents to support you in that, and it sounds like they did, so that's great. Yeah. So I think I'll move on to thank you both so much. I think Bonnie's on the call now, or she was a second ago. Yep, she is. And find out her story. And then we're going to, at the end of the webinar, we're going to be pulling you back in, Jana and Hillary and Bonnie, to talk about some other things. So thank you both. Bonnie, are you there, Bonnie? I see your name, but I don't hear you.
Can you hear me now?
Yes, but not very well. Can you?
Is that better?
Can you? Not really. There is. I don't know if you can see. There's an adjust mic.
Where at?
Yeah. That you can. Do you see it up there, Bonnie? In the left-hand corner, there's a microphone. Or are you on a? Are you? You're on an iPad. Okay. Do you see on the top the microphone?
Mine's, yeah, okay.
And if you click on the arrow.
Okay, good.
It is, yeah. Okay. Great, Bonnie. I'm so glad that you are on this call. And can you tell us a little bit about your, I don't know if you heard Jana and Hillary telling their stories. Just what's your decision about, are you wanting to have children at some point or not? And what made you come to that decision?
All of my, growing up, I wanted to have children, but that I had a really rough childhood growing up. So I kind of was like, well, I don't want my children to have that same sort of experience. So I sort of said I want to, if I have children, I want it to be a two-parent, not necessarily a two-parent home. We don't necessarily, if the relationship doesn't work out, that's okay. But I want the children to have a good family experience. So I said I sort of want to wait for that. And that sort of didn't happen for me. And so I was like, okay, I have to get my mind around the fact that I'm not going to have children. And then I met the guy, right? And then I met the right guy. So, and then we had to have a conversation, and it turned out that he really wasn't, he didn't really want to have children. And by that time, I had already made up my mind that I was okay with that. But that doesn't mean that we haven't had lots of family planning discussions and birth control discussions, and what does that look like for us, and lots of trial and error around what that is for us.
Mm-hmm. Great. Thank you, Bonnie. It's so interesting that you kind of made the decision and then
Yes.
someone that you could imagine possibly having a child with. And does that, and do you talk about whether you might change your mind about that, or are you both really clear that you don't want to have children?
We're really clear about it because we're so happy that we just kind of want to enjoy each other. And the ironic part about it is that the reason that I know that he is the right guy is because he sat me down and said, I can tell that you really want a family, and I don't want to take that away from you. So if you think that this is not the right relationship for you, then I think we should end it before it goes any deeper. And so that for me was I sort of had to have this moment where we took some time to really think about, what are we going to do? And I sort of felt like if we both feel that strongly about this issue, I felt like this is a relationship that I should stay in, because that's exactly the kind of home that I would want to raise my kids in, should I choose to have them, you know, like that healthy of a relationship. So that's how I chose the relationship.
Yeah, so it sounds like the fact that he really was so respectful of your decision and thought about maybe even ending the relationship, so if you wanted to continue on and have children, you could do that. And that
So
seems like that made him even more wonderful.
Because planful as you are, things pop up. You know, you plan to not do something. We did have a scare at one point where the doctor called us and said, "Oh, you're pregnant," and it was just not our news. He gave us somebody else's test results. So that was scary, and he handled it really well. So I think he handled it better than I did, because I was like, what? I came to terms with the fact that we're not having kids, and now you're telling me we are? So I think if that ever came to a point where we changed our minds, we would be okay, and it wouldn't end the relationship. It would just change. But at this time, we have decided that no, that's not something that we would do in our relationship.
So I'm gonna do a little intro before Erica starts talking about the different birth control options. So as you could hear from everyone, some people feel like they're not really making the decision for themselves. Other people are. You heard sometimes there's pleasant surprises, and then you've also heard that some people decide not to for all kinds of reasons. And then some people do decide to have children for all kinds of reasons. So these questions that were asked in the survey, how do I know if I want to have a child? Can you tell me how you came to the decision to have children or not, and what did you consider before? That was the purpose of those stories, is to tell people sort of there's lots of different ways that people think about this. All right, so we can go to the next slide, and I'm going to do a quick anatomy review. So as you can see the picture on this slide, that's an egg, and the sperm are coming towards it. But an egg is normally really, really small. It's like someone said it the other day, it's like a poppy seed. So they're really small, and sperm are even smaller. So the way that a baby is made, usually there's different ways, but the most common way is that the sperm that's in the testicles is ejaculated into the vagina, and that's done during penile vaginal sex. And then also the egg is released from the ovaries, and then the sperm meets the egg and a baby can start. So as you see on the slide, sperm plus egg equals baby. And like I said, there's other ways you can get the sperm and the egg together, but it requires a medical provider or a doctor to help you out with that. So there are other ways. And then the next slide. And this slide is just sort of showing that if somebody has penile vaginal sex, when I mean the penis and the vagina, and you can kind of see like the fluid comes out of the penis and the sperm are in the fluid, that they can get up inside the uterus and fallopian tubes. And I'll show you another picture as well. But what birth control does is it keeps the sperm and the egg apart, right? So if people are having vaginal sex, they my slide's gone. Okay, I'll look at my notes then. So where was I? Okay, so how it's done is either the birth control makes it so there's no egg release, so then the sperm could go up inside and no pregnancy would start, or it's something called barrier methods where they keep the sperm and the egg apart, and that's how they work. So just a couple more pictures on the slide. I think the pictures are coming. There we go, you got it. So just quickly.
For whoever's touching the slideshow, can they stop?
I'm not touching it.
All right. I'm going to move the slides if, yeah.
Can you go?
There we go.
Okay. Can you go a couple more slides down?
Which way do you want to go?
Down.
Like back or forth?
Forward.
Keep going?
Keep going. Doesn't seem to be moving on my end, but
all right now it's on the what is birth control?
Yeah, mine doesn't have that.
Yours doesn't have that.
That's the one I need right there. That's what I want. Okay, nobody move. And so you can see here, this is, do you see this? The ovary is here, and that's where the eggs are, and they're released about once a month, right? And when they're released, if the sperm meets the egg, a baby will grow. If they're released and no sperm makes it, then that's when the person has their period or menstruates, right? And blood comes out the vagina. But if the sperm meets the egg, that's where a baby's going to grow. And then the next slide, Anna. And this just shows you, you can see the circle at the bottom, those are the testicles, and that's where sperm are made. And they travel through a bunch of, tubes and add fluid, and then they come out the penis. It's in the fluid, the sperm. So they come out the penis. And then the next slide just shows you, and this is penis and the vagina sex, or penile vaginal sex. And you can see the penis is inside, and so if he were to ejaculate, the sperm would come out and possibly meet an egg. All right, so Erica's going to take it from here and talk about different ways that people, if they decide to have penile vaginal sex and don't want to have a child, how they can protect themselves from an unplanned pregnancy.
Can everyone hear me? Okay, can I have the next slide, please? Then the next slide. Next slide. Who?
Those are Randy's slides, yeah.
Okay, so let's go back to Randy. You go back 2 slides, and Randy, you take over. Then I'll take.
Erica's watching. Erica is going to describe all the different kinds of birth control that are out there that we can use. My job now is to make sure you understand that using birth control is not the same thing as having safe sex. There are a lot of types of birth control you can use that will make sure nobody gets pregnant, but they will not protect you from getting STIs or what is called an infection or disease from someone. Like if a person takes a pill or a shot, it will stop a woman from getting pregnant, but the people having sex could still get HIV from each other. Next slide. When you are having sex, there are 2 different issues that need to be addressed. Number one, when I have sex, there is a chance that I may or may not, or my partner will get pregnant. Number two, what steps do I need to take to make sure I am having safe sex? Next slide. Here is a picture of a male condom and female condom. When you use condoms the right way, they are the only type of birth control that will prevent pregnancy and protect you from getting a sexually transmitted infection. And of course, another, if you do not have sex at all, which is also called abstinence. That is another way not to get pregnant or sexually transmitted diseases. Next slide. Erica, you're up.
Thank you. So thanks for that introduction to the to birth control. So I'll go through the different types of birth control and tell you how they work. So the first question is, what is birth control and what does it do? So birth control is going to prevent pregnancy, and like Randy said, it's not going to prevent STIs. So it only prevents pregnancy. So it'll stop a female from getting pregnant. It stops the sperm from reaching the egg. It'll stop a woman's ovaries from releasing eggs that can be fertilized. It can be implanted into the uterus. And then, of course, there's abstinence, which is the most effective form of birth control. So with abstinence, you're not having any sex. So that means that you can't get pregnant if you're not having sex. And always remember that birth control is your choice. It should never be forced on you. And then with the different types of birth control that is available, you can choose. So no one can force you into a certain type of birth control. So just keep that in mind. And then again, down there at the bottom in red, birth control, all birth control is not going to protect you from STDs. Next slide, please. So again, we'll go through the different types of birth control and how you use it. So abstinence, again, is the most effective form of birth control. So abstinence means there's no sex whatsoever. So no vaginal sex, so no penis into the vagina, no oral sex, which is mouth on the penis or mouth on the vagina, and then no anal sex, so no penetration in the behind, in the anus. Abstinence is a choice, so no one should force you into not having sex. So if you want to have sex, as long as you're having safe sex, again, it's your choice. And abstinence is 100% effective. So if you're not having sex of any type, then you can't get pregnant. Next slide, please. So then the next method is the hormonal method. And so that one is going to stop the sperm from joining with the egg. So when a woman ovulates, that means an egg is released to be fertilized by sperm. So the hormonal method is going to stop ovulation from happening. Your doctor has to prescribe this type of birth control for you, for the woman who chooses to use it. So the different types that she can choose are the pill, which is a small pill taken every day. There's a patch that can be worn on the belly, on the butt, or the upper arm or back. And then the woman will keep that patch on for 3 weeks and then take it off, have her period, and then put the patch back on for another 3-week cycle. There is something called the depot shot. So that's a shot that she will receive in her arm, and she'll get that every 3 months. And then there is what's called the vaginal ring or a Nuva ring. And that's a flexible ring that's inserted into the vagina. So like the patch, it works in a cycle. So she'll wear it for 4 weeks and then take it out. And then with the vaginal ring, she can leave this in and have sex when she has a vaginal ring inserted into her vagina. Next slide, please. And so these are the different types that we just talked about. So you see at the top left-hand corner, that's the pill. So you take a pill every day. And then next to that is the patch, and those are the different places where the patch can be worn. Underneath the pill, you'll see the depot shot. So it's just a shot in the arm 1 time every 3 months. And then the last one is the vaginal ring, and it's inserted into the vagina, as you can see. Next slide, please. Then the next type of birth control is the barrier method. And so that is going to block the sperm from reaching the egg. So those will be condoms. So that's the male condom and the female condom. And this is the only type of birth control that can potentially protect you from STDs. So again, like Randy said, when used properly, they can protect you from getting pregnant and they can protect you from getting STDs. But keep in mind, the only way that you can protect yourself from an STD, let's say if, for an example, if it's if someone has herpes, and the herpes you'll only be protected from herpes from the part that the condom covers. So if there's herpes on the penis or herpes in the vagina or whatever else, so whatever touches that part, whatever the condom is covering is the part that will be protected. So again, if someone has herpes on their legs or on another part of their body that's not covered by the condom, then you can still potentially get herpes. So but it will, condoms, if used correctly, will protect you from chlamydia, from gonorrhea, from certain STDs. So again, when used properly, they will protect you. And at the end of this presentation, there is a section, a resource section, and there are videos on there that will show you how to properly use the male and female condom. So if you're interested in that, then there are links there that you can click on and you can watch a video on how to do that. Next slide, please. And then the next type of birth control is the long-acting reversible contraceptives. So that's the IUD or the hormonal implant. So with the IUD, your doctor has to put this puts this into the woman's body, and it will release hormones that will prevent pregnancy. It'll prevent sperm from getting to the egg. And if you get the IUD, again, your doctor has to put it in for you. And when if let's say you change your mind and you want to have children, or you don't want to have an IUD anymore, you have to go to your doctor to get it taken out. You can't take it out yourself, and you cannot put it in yourself. Then we have the hormonal implant, which is a thin rod, so it looks like a matchstick or like a toothpick, and your doctor or a nurse will put it into your arm, and it's going to release hormones into your body that will prevent pregnancy. And this can last for up to 5 years. So again, with these two types of birth control, your doctor has to administer these for you. So again, with condoms, you can go and buy those from the store. You can get them from your doctor. So you can easily get those. But with these particular types of birth control, your doctor has to actually implant these into your body. Next slide, please. So that's there's an IUD that's off to the left-hand side. And then if you look closely at the arm on the right-hand side, you can see the hormonal implant in her arm around, in her bicep area. So it kind of sticks out a little bit, and so you can see it there. Next slide, please. And then another type of birth control is emergency contraception. So it's a safe way to prevent pregnancy after unprotected sex. So if you have unprotected sex, if the condom breaks, if the condom comes off, you can use the morning after pill or Plan B. You can buy this at the store, or you can get a prescription from the doctor. So you do not have to have a prescription to get this medication. So you can go to your local drugstore like CVS or Walgreens, and you can get this over the counter without your doctor's permission. And you only have to be 16 years old to get it. So if you take the pill, you want to take the pill within 72 hours, and that's 3 days after unprotected sex. And the sooner you take it, the better it will work. So if you had unprotected sex, let's say tonight, and you feel like you might be pregnant, you might want to go and get the Plan B pill tonight and take it tonight, as opposed to waiting a few days in order to take it. So remember, the sooner you take it, the better it will work for you. It's not going to cause an abortion. It blocks the sperm from reaching the egg. Next one, please. And then there's some other forms of birth control that aren't as common. Some are common, but others not so much. So breastfeeding as birth control, for an example. So when a woman has a baby, she can breastfeed, and when she's breastfeeding, her body isn't releasing a certain hormone for her to have a baby, to release an egg. So as long as she's breastfeeding continuously, it can potentially be a form of birth control. The next type is outer course. And that is basically no penetration with the penis. So of course, as we know, if the penis is not penetrating the vagina, then there's no way that a woman can get pregnant. So with outer course, again, there's no penetration whatsoever with the penis. Then the next is sterilization. So a tubal ligation or getting your tubes tied, that's when a woman gets her fallopian tubes tied. And so then that way the egg cannot be released, and therefore the sperm won't be able to get to an egg because there is no egg. And then men have what's called a vasectomy. And so they get the different tubes or all that release the sperm, or that sperm travel down to exit out of the penis when he ejaculates. Those get cut or severed, and with that they can't ejaculate sperm. A vasectomy can be reversed, however it is very expensive to do. And real quick, let's go back to getting the tubes tied for a woman so she can get her tubes clamped. They can be burned shut, and that is not reversible. So once her tubes are tied, a woman can't reverse that particular procedure. Probably the most common form of birth control and something that we've all heard about is withdrawal or pulling out. And so basically that means when a man has his penis inside of a woman's vagina, they're having sex, and the man pulls out before he ejaculates. Now, it gets a little tricky because if the man has already started ejaculating and he might not know, then sperm can still be passed to the vagina, and the woman can still potentially get pregnant. But withdrawal or pulling out is a very, very common form of birth control, and I'm not going to say it's 100%, but when done properly, it can potentially work. So if you have any questions or whatever else about that, you can put that in the chat box, and we can answer those questions for you. And I think that's my last slide. Oh, no, I'm sorry, I have one more. So the side effects of birth control. So the question was, does it make you sick? And birth control side effects are very rare, so they don't happen very often. So the not so serious side effects can be a headache, nausea, and a woman may bleed between her periods. And then serious side effects that aren't very common at all are heart attack, stroke, blood clots, cancer, and in some cases death. But remember, those are not common at all. So when you're talking about trying to choose birth control options, you want to talk to your doctor or someone you trust about your birth control options and what will work best for you. So for an example, if you know that you can't take a pill every day and it's going to be hard for you to remember to do that, you might not want to take the birth control pill. You might want to try an IUD or a Depo shot or another form of birth control that you don't have to worry about taking care of every day. And just remember that no matter what, it's your choice what type of birth control you choose, and it's your choice if you want to use birth control. And I think that's my last slide.
Where can you get birth control? It depends on what kind of birth control you are using. If you are talking about birth control pills, you get a prescription from your doctor, and then you get the pill either at a pharmacy or Planned Parenthood. Sometimes it can be mailed to you to your house. For an IUD or a shot, you get a doctor's off. You go to the doctor's office. Next slide, please. To get condoms, you can buy them at a pharmacy, grocery store, convenience store. Buy them online. You can get them for free at Planned Parenthood and at the Department of Health. I know we give them out at our self-advocacy conferences, and you can get them from a friend or someone in your family. But if someone gives you one, please check the date to make sure it is still good. To buy Plan B, that is the morning after pill that Erica was talking about. You can buy Plan B at a drugstore, or you can also get it from the doctor. Next slide.
All right, so I think I'm going to start this part, and then Randy's going to finish up But we're going to ask the self-advocates to talk about if they're not planning to have children right now, which it sounds like all three are not, what steps are they taking to not have a child? Are they using birth control? What kind? You know, just to hear a little more about what works for you or not. So, Bonnie, are you on? Do you want to go first?
I'm here. Can you hear me?
Yep.
Okay. So, were you asking what I'm using for birth control?
I was asking if you're not planning to have a family right now or ever, what steps are you taking to not have a child? And have you used birth control? What kind? Were you happy with it? So there's questions on the slide. I don't know if you can.
So yeah, so we went through various steps. We started with pills. That didn't really work because I'm too busy to really keep a schedule for the pill. Then moved to Depo. That didn't work. I didn't really like the Depo. And then I moved to I forget what it's called, but the implant one, and it worked for the first, I want to say, year and a half, and then I just didn't feel right on it. So I went off of that, and then but that whole process was a real struggle because through all of these things, it was a struggle to get it paid for. Like, aside from the pills and the Depo, it was a struggle to get it paid for because insurance didn't really want to cover it. And I was fortunate that the first couple of times the hospital covered it because they felt prevention was better than me getting pregnant. And so they did some emergency funding and covered the birth control for me because it was expensive. And then after that, when for what I'm using now, I decided to go with IUD. It helps, to not have appointments all the time and my schedule, but it's not the Mirena, it's called Liletta. And that was it's not covered by insurance, so I had to work out something with my doctor to go on a payment plan to be able to have it covered. Insurance is complicated to having a disability and what they're willing to cover because they apparently think that we're not having sex. So the IUD was a complicated thing for me to decide to do because I wasn't sure if I would end up having more health problems, less health problems, but I'm really happy with that decision. I haven't had any more health problems because of it. And they were really kind and knocked me out, so I didn't have to go through any discomfort when I had to have it inserted or anything. So that was nice. So I think that about covers it.
Yeah, great. Thank you. It sounds like you've tried lots of different ones and have finally found one that works for you. And I think that's what's important with birth control is finding the one that works for you. And like people said, it's hard to remember to take a pill, so they try something different so that they're protected. And
one thing I do want to add, all of that took a lot of advocacy because it's important to speak up for, the right that you have to be having sex, and it isn't just about. I think people are more comfortable when you're talking about being safe, like as far as being safe from someone taking advantage of you, and a lot less comfortable with your right to have sex.
Mm-hmm. Yeah, I think
So
that's
there
a
was
really,
advocacy involved in that. The whole
definitely.
part of it.
Right. So you might say, oh, I want birth control, and a provider says, well, you shouldn't be having sex. And then you
Yeah.
speak up and say, I have the right to. Yeah. And you also brought up insurance, which is a really interesting topic too. Like, who decides what is covered and not covered for contraception?
Yeah. One thing, so in my last venture of this, insurance was willing to pay for me to have a procedure where I wouldn't possibly not be able to have children, but I could still possibly get pregnant, and then it would put me and the baby in danger. But they would not pay for me to have the birth control.
Interesting.
So that's, I had to work out a payment plan with my doctor to actually have the birth control,
Right.
and not have the procedure that the insurance would pay for.
Interesting. Yeah. So not only giving you certain choices. So Hillary,
Right.
what about you? You use the Mirena, you said. Can you tell us a little bit? Do you like the Mirena? And
Yeah, I actually really like it. I just got my new one in yesterday because it's been 5 years since my old one, and I actually like it a lot more, a lot better than
yeah, you don't
taking
have
the
to think
pill.
about anything. Yeah, great. Yep. Yeah, and did you use the pill before and then Mirena? Are those the only two you've used? Okay. And Jana, how about you?
Yep.
You take the pill. Yep. And do you like it?
I take the pill.
And you're good at remembering to take it?
Yep.
Awesome. Good for
Yep.
you.
I did take it this morning.
Yeah. Do you ever think about trying something different, or are you just really happy with it?
I'm afraid because I don't
Right,
like shots.
yeah.
I didn't want to get.
That makes sense. Yeah. So I have one comment that was left on the chat box during one of our webinars for the three of you to respond to, and then Randy's going to ask another question of all of you. Okay. Thanks for sharing your experiences. So somebody wrote, if, like me, you and your partner are trying to have a baby, we're both autistic, we can't use protection if you're both consensually trying to get pregnant. I want to make sure that people know it's okay to try and get pregnant, and that you can't use protection if you and your partner are trying. So do you have any comments about that? Do you think it's important for people with disabilities to know they have a right to have a child? Like, what are your thoughts?
Absolutely.
How come?
I think so. Yeah.
Can I speak on this?
I don't know.
Well, it's basically their lives. If they want to conceive, they have a choice.
The same way as regular people, I think. When regular people have babies, I guess people with disabilities should be able to have a baby.
Right. Yeah. So it doesn't matter if you have a disability or not. Everybody can make their own choices about it. Yeah. And Bonnie, did you want to say something before I pass it on to Randy?
So the last time that I was trying to get birth control, and they said that they would pay for a procedure where I possibly wouldn't have children. That was very traumatic for me, because even though we've made the choice not to have children, I don't feel like it should be a decision made by someone else. So my boyfriend and I had a long conversation. Even though we don't want to have children, it shouldn't be up to someone else to make that decision for us. So we discussed it, and we said we would rather have the birth control than have those very definite options, put in place without it being our choice, and having like insurance or unless it's a health risk reason why we have to make that choice. We have the right to have children if we want to, and it should be when we're ready to make that decision for ourselves. It shouldn't be because of a disability. It should be because we're making this choice for ourselves.
This is Julie. I'm going to jump in. We are right at the hour, so we're just going to go to our last two or three slides. So we can go to the next slide, Anna. I think this should be our resource. Oh, we had one question. I did note that, and we will address it in one of our future webinars. I do want to make sure that you know that there is the resource list that Erica had mentioned with the videos related to how to use a male condom, a female condom, and then there are 2 websites where you can learn more about birth control, different types, and how to access those. And then our last slide is our next Sex Talk series, number 6, is going to be on LGBTQ plus relationships. We have not determined a date, but we will be, as soon as we have a date, we will get that out. If you have registered for any of our previous webinars, like today, you will have access to that information as soon as it is made available. I would ask that certainly Anna is going to share a link for the survey here at the end. Please take time to fill that out and give us the feedback. It is very helpful for us and for our panel. And I'd like to certainly close by saying thank you to Catherine, Erica, and Randy, and Gianna, Bonnie, and Hillary for joining us today. Thank you. Thank you.